carotid puncture to diagnose tumors and hematomas. Carotid puncture means
AI is transforming every field nowadays. So, what's your perspective on this, and where do you see taking this neurosurgery in the next 5 to 10 years?
in neurological field, certainly there is a role of AI. There are a couple of new platforms being developed.
So, what's your advice to the future neurosurgeons or aspiring neurosurgeons?
The first mistake usually a young doctor does is MBBS, as all of you know, is one of the toughest exams to crack.
Welcome to today's episode of the Neurosurgeon's Perspective, Brain, Balance, and Beyond. I'm your host, Ria Midha, and today we have a truly inspiring guest, Dr. Vikas Gupta, one of India's most respected neurosurgeons, stroke specialist, and pioneer in neurovascular and endovascular surgery. He is among the first few clinical neurological specialists who ventured into neurointerventions in early 2000s after proper training which was not even available that time in India, from University of Zurich, Switzerland. Since last 20 years, he is practicing neurovascular surgery and stroke. With 3 decades of medical experience, Dr. Gupta has performed some of the most complex brain surgeries, led groundbreaking neurovascular interventions. Beyond his skill in the operating room, his journey is one of deep compassion, innovation, and service to humanity. In this conversation with him, we will know about the fascinating human brain from Dr. Gupta, what drew him to neurosurgery, some of his most memorable cases, the evolution of medical training, and how neurological health connects with our mental well being in today's this high pressure world. So let's dive right in and get a glimpse inside the mind of a neurosurgeon.
Namaskar, I am Dr. Vikas Gupta. I have decided to do this podcast to share my experience of the journey of last maybe 40 years. I joined MBBS in 1982, became a surgeon in 1992, and joined neurosurgery in 93 and passed out in 98. Since then, it has been a fascinating journey. To say what I learned in medicine is very difficult, but what I will say is medical science or surgical sciences, especially neurosciences, is really a tough branch. You see in the serials, movies, to call somebody a neurosurgeon is a glamorous thing. There's nothing called a glamorous, it is sheer hard work. It is sheer hard work beyond imagination, day after day, hour after hour, 65 days a year. But I enjoyed every bit of it. Every moment was enjoyable. So when somebody asks me how many cases you have done, it's very difficult to answer. But what I can remember is, surgeon, there has not been any day since I have not operated. So maybe 3, 4, 5 cases per week. Why I ventured into neurovascular? Because when I was a student, somewhere around 95, 96, 97, 98, CT and MRI, which are so common these days, it is available along all roadsides. They were literally making an entry into Delhi. So we used to do a carotid puncture to diagnose tumors and hematomas. Carotid puncture means you used to puncture a needle here in the neck and inject and see on the X-ray which side is a tumor. So that is so frustrating that you want to puncture one artery, gets punctured somewhere else. Patient is restless, it's bleeding. From there, the journey evolved. Incidentally, one of my mentors, Professor Anil Karapurkar, joined Apollo at that time and somewhere around 1995, and he left somewhere early 2000. So he was one of the instrumental persons who is the guru of Indian neurointervention, who started intervention in 1997, 1987 or something like that. So he inspired me. So from there, from direct carotid punctures to advanced devices now we have. That is a fascinating overview I can share with you at this stage of my life and career. Why I'm saying so? Because medicine is not only a profession, it's a calling. I always tell my children, don't join medicine because you see your father is a successful doctor, or if I may use the term rich doctor. But you have to be passionate. You have to be get up at any time whenever your call comes. If you don't have it inside you, don't do a medicine. There are thousands of ways of earning living. There are more glamorous ways of earning living. The first call it anybody who decides to take up medicine is that empathy should be the first thing. You should be having empathy. You must get up, stand next to the patient. Sometimes you simply cannot help, but my presence or your presence is likely to give reassurance to the patient that doctor did try to explain his best. Number two, neurovascular is the toughest. It is the youngest subspecialty. It's a very, very unforgiving super specialty where we are operating from about a meter away. Our devices are about 105 centimeter long. We are operating from a meter away, looking at the monitor. So hand-eye coordination. One mistake and brain is unforgiving. Usually patient pays his life. And believe me, as a human being, you cannot sleep home for next couple of days. So all those who wish to join your intervention, my message to them is get yourself trained adequately, because the more you get trained, the less complication there will be. And society needs neurointervention like anything, because in India, whatever the latest stroke statistics are coming, it is frightening to see that even Niti Aayog data is indicating towards about 200 to 300 strokes per hour in India. And there are not even 100 centers which are equipped to do acute strokes at present.
That was a wonderful perspective, and your story is truly inspiring. Sir, as neurosurgery itself is a very demanding field and it has various disciplines and subspecialties, as you told us. So, kindly shed some light for our viewers about these various disciplines and subspecialties in neurosurgery.
So my neuroscience journey, as I told you, started in somewhere 1993. In January, I joined SGPJ Lucknow, subsequently moved to JB Pant. So at that time, our major workload was trauma. Head injury used to be the major work. Brain tumors, yes, and grew over time as with the advent of modern radiology like CT and MR. And spine surgery used to be really rudimentary. In the sense, we used to do spine surgery, but now with the advent of modern implants, we have advanced much more. So from 90s to 2025, number of subspecialties have evolved. Number one, as I myself practice is what I call myself, or people call me as a neurovascular surgeon. I am specializing in the arteries and veins of the brain. I specialize in the stroke, both endovascular and microvascular. That is one of the very tough specialties to do. Another specialty is epilepsy surgery. Again, India has a huge population of epilepsy patients who are not controlled on drugs. Sometimes they need epilepsy surgery, which was a field unknown about 30 years ago. The other thing is movement disorders, pediatric neurosurgery. Pediatric neurosurgery has emerged as a separate field in itself, and of course, advancements in spine surgery. So now neurosurgery as a broad spectrum means not only head injury is just one part of it, but 80-90% work revolves around minimally invasive procedures like with endoscopes, with advanced machines, microscopes, maybe image intensifiers, modern cath labs, neurovascular cath labs. So I have seen the wonderful evolution of neurosurgery from 94 to 2025 or something like that.
That's a wonderful journey, sir. From 90s to till now. I think I was not born that time even. But yes, it is amazing. So now, as you told us, as we all know, you have performed countless surgeries. But is there any one that stand out? Perhaps something deeply emotional or memorable in your journey so far?
There may be many, but few years ago I operated upon conjoined twins. They were few months old. They were joined at the back. They were born as twins, but not separated due to a birth defect. And their spinal cord was fused. That is when I came in. It was one of the most complex surgeries. Trust me, we had to create a team of 40 people because human soul child needs different type of anesthesia, and there were two children. Two different anesthesias had to be given, and blood loss was a challenge. That you have to do it in the minimum possible time and minimal blood loss. We started at 6 in the morning. We finished by maybe next morning 6 o'clock. Both babies survived. Both babies are walking, and this is one of the most gratifying surgeries which I remember, and the parents are grateful too. Yes, these are remarkable things which actually make up what the medicine is for.
That's incredible moving. Parents and even I guess all society is very grateful for you. Sir, on the other spectrum, I want you to tell our viewers that you have been in this field for over 3 decades now. How has this medical education and neurosurgical training evolved since your days as a student to now?
It is something which is very deep to my heart. We as medical students, at least I joined voluntarily. I continued to study till maybe 35, 37 years. We never used to bother about duty hours, offs, Diwalis, festivals. Maybe we were wrong, maybe we were right, but that was the commitment we had as students, even as consultants. But now I see a debate, mental stress, medical students committing suicide, burnout due to long duty hours, 36 hours duty we will not do. Probably they should not do in modern times. But at that time, even 48 hours duty was something normal. So that those were different era, those were different times. I'm not advocating anybody that somebody should be doing long duties. But I feel somewhere during this last 20 years, the training, especially in the surgical branches, the level of training, the volume of training is going down. In fact, I have opportunity to interact with young, enthusiastic boys and girls pass out neurosurgery. They choose to work with me without any criticism to anybody. But I can distinctly feel that they have not been adequately trained and it is not their fault. Maybe the institution did not have adequate volumes. Maybe the institution had too many students. That the per case per student did not get enough attention. So it is very sad to note that yes, we are producing more doctors, maybe for good or for bad, but training has suffered. For a student, my message is obtaining a degree is good, but please obtain experience in a high volume center for a couple of years, or which will be invaluable for you for rest of your life.
And that's a great point, sir. And now that brings perfectly me to another topic from this only, as you said, depression, mental issues. So, from neurological perspective, which age group today is more prone to depression and why?
The most sad part of depression is that I am seeing children in depression. I work in this part of uh, East Delhi, Noida, where young population works in this BPOs and other places. These young boys and girls live far away from home. They work at odd hours and they're suffering from severe depression. I simply don't understand. And whatever you wanted, you have achieved, or you will achieve. You have your full life ahead of you. What are those causes? I don't know. But what I guess is somewhere some spiritual disconnect, too much materialistic thought, too much of hurry to catch up with others, and very less contentment with whatever we have, and family detachment. The relationships are becoming so fragile that children do not confide in their parents, partners do not confide with their each other. So everybody on his own. That is leading to what I often talk about as urban loneliness. We humans are social animals. Till we have a good social circle, whichever elderlies used to have in the mohallas, chopals, or wherever. That time is mostly spent in the bars, pubs, in front of TV, cinemas, sitting alone. That is the leading cause of depression, according to me.
According to you, like as you said, poor work life balance, as it is around for all of us, like corporate cultures or as you said, BPOs and everything. Sir, how it is related to mental health challenges and how to work upon it as a like normal person in our day-to-day life.
My answer to this may be slightly philosophical. Corporate is by nature a entity created for profit. Human beings are not. We should, or I should, look for work which I enjoy and not be bothered about the profit. Let the people who run the corporations, they worry about the profit. If it affects your health, that will lead to all kinds of psychological issues, all kind of physical issues, and God forbid, family issues. So to work in the corporate, I was probably the first employee of the corporate in 2004. I started working in Fortis Hospital, which was the first corporate hospital in Noida. Probably in North India was the first corporate hospital in Delhi. So from there, I can say in last 20 years, what I've learned is do your best, do very sincerely, but always remember that your body has limits. Do not overreach. Do not say yes to anything which you cannot do. Do not say yes to unrealistic timelines. Do not neglect your professional work and never neglect your family time. That is probably will be helping a lot of young people. But nothing is going to be achieved if family is lost or your own health is lost.
Very useful advice for the people listening to it. One more thing which our viewers will like to ask to you, that as AI is transforming every field nowadays, so what's your perspective on this and where do you see taking this neurosurgery in the next 5 to 10 years?
Certainly, as we've seen in last 4 5 years, is transformative. It has transformed numerous things. In medicine, whatever the initial impact we have seen is in the basic field of radiology. That the machine learning has taught how to read X-rays. On the ground, practically what we have seen is that it has impacted the diagnosis of tuberculosis. Thousands of X-rays are done, and with machine learning, early diagnosis can be done. In neurological field, certainly there is a role of AI. There are a couple of new platforms being developed where a CT scan is done. If I say 50 kilometers from my center, and it is fed into that software, I'll not name the commercial names. It is not worth it. So even I on my smartphone can see that this is a stroke which can be opened. So in that sense, patient can be directed directly to the stroke center and get a timely treatment. Will AI be performing real-time surgeries? I really doubt it. Yes, we have seen robotic surgeries. Of course, robotics is not yet in neurosurgery, but robotics as such is not an independent tool in medicine, as we see robotics in industrial context or in the other sectors. It always has a human interface and a human control. So robotics may make surgery minimally invasive. It may make surgery more precise, but I cannot foresee in my vision that it will replace humans or it will be completely motorized or computerized or AI-led surgeries or procedures.
All right, sir. And I think AI will help,
Yes.
obviously help, but can't replace because humans and their learnings are unmatchable. That's true. Sir, for our listeners, means who might be inspired to pursue neurosurgery or neurovascular work. So, what's your advice to the future neurosurgeons or aspiring neurosurgeons, both professionally and personal level?
I'll say that my journey as a neurosurgeon has been fantastic. I loved each and every step up. Do join neurosurgery. It is a fantastic field. It is really gratifying to see somebody unconscious getting up in the morning. Whether they say thank you or not, but to say thank you to the doctor is becoming a old thing. But it is doing a stroke and preventing a young man. Last week I did a stroke in a 29 years old boy. Preventing it this lifelong disability. He was due to get married next month. Is a gratifying service to the society apart from the financial aspect of it. But only advice I'll give to youngsters is do join neurosurgery only if you're passionate about it. Don't do it as another MD degree to be added or MSMCH degree to be added. And for neurovascular surgery or neurointervention surgery, you have to train adequately. What I commonly see is request for observership for 1 month, 2 months, and then company people will teach me. No, please spend adequate time, couple of years, at least 2 years, to get properly trained. Because I said brain is a very, very unforgiving organ and you are operating from 1 meter away. One mistake, trust me, patient is gone. Our lives are in their hand. Their lives are in our hand. I'm sorry. But do come. It's a fascinating field, but only if you have passion for it and you can have the patience to train yourself best.
So your words are truly inspiring, and I really hope that our aspiring neurosurgeons will take your advice and look forward to it. That's very beautifully said. So before we wrap up this conversation, Dr. Gupta, what message would you like to give to our listeners about brain health, mental wellness, and balancing a demanding life?
Yes, mental health, wellness is concerning all of us now, including the mental health of the doctors. We are again coming under increasing pressure, both of the corporate who pushes longer hours. I have fortunately left the corporate world. In the other sectors also, I see people burning from 8 o'clock till 8 o'clock, be it lawyers, be it others. Contentment somewhere, professional contentment that yes, this much I can do. I will do whatever I can do is to my best. I will not overreach. And at the end of it, it should be professional satisfaction, peer validation, society validation. I see on the Facebook people are putting photographs of each and every event, each and every award. What is this validation leading to? This is probably somewhere a loop which will never end. Certainly, we need publicity. Certainly, we need visibility. But to chase that visibility and spoil your life, I don't think it is worth it.
That's true, sir. And so, for our general public, like what are some of the things that we should take care of for our mental health and some of the neurological disorders that we can like take this advice, we can take care of this.
As a now a senior person, I can say at least spend half an hour outside your home, either early morning or late evening. Walk. You may not go to gym. I don't mind, but at least walk. Fresh air. Be alone. Walk. Talk to yourself before you go to the bed. What did I achieve today? What I did right? What I did wrong? What I can do next time? Second thing is for your own mental health, don't overstretch. Don't take unnecessary responsibilities. And if I'm permitted to say, don't take unnecessary loads. Where I see I have interacted with about 100 young neurosurgeons in the last 20 years. My both children are doctors. The only advice I can give to them, don't take car on the loan. Don't take house on the loan. The first mistake usually a young doctor does is the moment he passes out, he says, oh, I'm a neurosurgeon, I'll take a big car. And that EMA will bound him down for 5 years. The moment he get married, then he'll say, I'll buy a flat. That EMI will bound him down for next 20 years. He will not, he will become a slave of the corporate. And instead of investing time on his own training, he will continue to service the banks. So that adds to the stress. The medicine is as such one of the very stressful branches. MBBS, as all of you know, is one of the toughest exams to crack. We have about 5,000 exams in 5 years, which is a hell lot of a stress itself. You have come a beautiful journey. Our profession is beautiful. It is meant to be independent. We are healers. We cannot call our patients as clients. But the moment we get into that financial, what we call Ninyanvega phase, we make our own life hell. And this is true for majority of the doctors.
So, as we know that you have been in this medical field from past 3 decades, so as we know, you have been a part of very organizing committees, national and international committees, SEBICON, like this. So, please shed some light on that.
Yes, these associations are important. I am member of numerous associations, right from American Association of Neurosurgeons, Congress of Neurological Surgeons America. Those are namesakes. Neurological Society of India. What I have significantly contributed to the association is we founded a society called Neurovascular Society of India, Society of Neurovascular Intervention (SNVI) in 2016, which is focused on providing a platform for clinical neurosurgeons or neurologists to perform good ethical work in the neurointerventional field. And for past 9 years or 10 years, this association is free of politics. We are purely doing academic work. We are a very good cohesive membership, and it is gratifying to say for me that I am the vice president of that uh, association, and we see young people coming up with better and better outcomes as a result of some efforts of this association. That is what I think is my contribution back to the society.
Thank you, Dr. Gupta, for sharing your insights, compassion, and decades of wisdom with us today. To our listeners, I hope today's episode helped you see the brain not just as a biological organ, but as a reflection of who we are, our emotions, resilience, and creativity. If you enjoyed this conversation, don't forget to follow the podcast, share it with others, and leave us a review. Until next time, stay healthy, stay mindful, and take care of your brain.